to the paper case file record, okay, to the paper case file. One sheet is given to the provider as the services coordinator is walking out the door. And then one sheet goes to the office assistant and completes the monitoring checklist spreadsheet. And
wait, hang on, Jean. Goes to the who? Office assistant?
The office assistant who completes the spreadsheet. Yeah.
That's admin assistant, you know.
Okay. So who originates the monitoring checklist spreadsheet?
The services coordinator completes it.
Okay.
Is this something that is just, what is the perspective? This is not at a person level. This is at a organization level, facility level. I'm trying to get.
It's actually the checklist. You mean the completion of the actual checklist?
Yeah, I guess what I'm seeing here is this something, who would look at this? Would this be, you know, because we're starting different concept. We're starting to build things that where if you're working in the system, it's because you're working on a person, or you're working at a dashboard level, you're trying to see how the organization's going. Who would be looking at this?
This would be looked at by the managers, the supervisors. So,
within each facility, or like even more macro?
At the county level.
Okay.
This is all completed by county personnel. So I go in and look at, Tony is on my caseload. I go to the Shangri-La house. Shangri-La is a provider. I go to one of the houses run by Shangri-La where Tony lives. And I've taken out the individuals' names for HIPAA, obviously, but
right.
The real checklist back at the ranch has everybody's name. So that would be, Tony, his services coordinator is Julie Hoyt, and all of the reviews are conducted, and then there's a column for follow-up. And basically what the supervisor wants to know is, A, did the review actually happen, and B, did the follow-up get completed?
Does the individual only show up once, like on column C? Tony doesn't live, like there would be, we're looking at the spreadsheet on the screen, there would be Tony, Scott Strawman.
Yeah, right.
Okay. And that way you could, if you wanted to on the spreadsheet, the way they use it now is they could say, let's take a look at Tony, and they could filter on Tony, and that would result in there just being one row.
Well, there could be two, because also if Tony goes to a day program, then on an annual basis, there needs to be a review of that day program. In Oregon, frankly, it's less likely that the day program info is going to get completed on the monitoring checklist spreadsheet.
So is the spreadsheet, okay, this one's residential, but it could also be the day programs, any other. Yeah, frankly, if we were more together, it would include the day programs.
Okay.
So is it only those two types of?
Then, like this, there's almost two views to this, and so at Shangri-La, Julie Hoyt, who's filling out, that she did a behavioral review only on Tony, sees probably something a lot simpler, and then the results of her efforts get represented in this larger view sheet.
Exactly. Okay. Yeah, and what. So as it's an Excel workbook, so things can be rolled up. So it's like, okay, let's sort for Julie Hoyt and see how well she's doing in terms of follow-up. Let's sort for Shangri-La and see how well they're doing in terms of completing what the services coordinator directed them to do.
Okay.
Guys, I'll be right back.
Okay.
So on this, then... it's the way people are used to currently using it, or the people that work on the spreadsheet. All columns, they're used to the concept of being able to sort and filter.
Yes, right. But what's happened here, because our electronic health records is so primitive, basically, here we are with this other completely separate from the electronic health record system, this monitoring checklist spreadsheet. And so this would be something that it would be really useful to have as part of the electronic health records. So that way, when I open up Tony's electronic health record, I can see, when he was last monitored, what the follow-up was the follow-up completed.
What type of data, like looking at Shanghai, what type of data would go in columns E, F, and G? Is that like a checkbox, or what does that mean?
That's a good question.
Would it be a date? I mean,
I'm thinking it was the date.
A date that it was completed. Okay, so I do have a question, like medical service review, right? If there's a date in there, I'm just, as we digitize this and program it into our prototype, there's a lot of things that we could expedite because we can pull data from, if the medical service review was done, if that's already captured in the system, we can automatically just populate this field here.
We can input that Excel spreadsheet directly in, and it becomes a data sheet.
That's what I assume.
Yeah.
Yeah. So the medical service review, is that their annual review that they have to do, or is that just as needed? And is there anything in the system we have right now that would tie to that? And let me.
Or do those dates come off of the monitoring review form that you sent us?
I mean, technically, those reviews need to be done once a year.
Oh, I see the medical services review. Okay, yeah. Okay. Let me pull that over. So the other, you got to rotate that one. Oops, wrong way. Okay. So, and let's see. We don't have this. Nora, are you back?
Yes, I'm here.
Okay. Let's see. Okay, so the medical service review, we don't currently have this in, which is fine. We can get that in. You're messing with me, Gene.
And I don't know what I don't know what the value added is of actually putting these documents into the electronic health records.
Okay.
Because if you do, what that's going to mean is that somebody's going to have to go back to the office, and take on paper out here.
Well, there's the concept of, I don't necessarily think that depending on how we want to sell this, we could always put this on a handheld for them to upload when they get home to get back to the office. I don't think that they actually have to do it on paper. But I'm just thinking about that Excel spreadsheet and how electronically perhaps there's a better way to demonstrate that.
Yeah, I think so. I think we have to.
Yeah, I think we can do that.
We need to frame it out a little bit better, because it's not just simply taking this Excel spreadsheet and making a screen look like this. I think there's other ways to do it.
Well, exactly. It's pulling from different data points you've already got in the. So I love the idea of completing those on a handheld, and somehow a copy of the completed form needs to get back to the provider.
Okay.
So that would be interesting. It's like does it get mailed?
So
it's emailed.
Well, maybe when it's done, I don't know if it's an alert necessarily that this is just, it shows up on the provider's dashboard that, this is, or maybe it just automatically goes into the client's record at the provider level, that's been completed just as and an alert shoots to the provider saying, the medical service review has been completed by the service coordinator, now available for, it's been saved to your record or something like that. We can figure that piece out. But let's just go back to so these are done on an annual basis, and so it started by the service coordinator. I just want to confirm with you, and that person works at the county.
Yep.
In Oregon at least. Is that, just to confirm, so everyone's on the same page, is that the same person as the case manager in your mind, yeah. Gene, or is that?
No, it's the same. We use, what other states call case manager,
okay.
We call services coordinator, because sometimes the provider can have somebody who they call the case manager, who does things like take the person to doctor's appointments and so forth. So,
sure, okay.
The person coordinating the service plan, the person who coordinates the service plan is, in our state, the person who's called a services coordinator and who works for the county.
Gene, can I ask you for the, so this review is for, it also includes the budget review? These monitoring forms? I saw a financial part.
Right, and that financial is not the individual's budget. It's more how it is how the individual's sort of ready cash is being handled.
Okay, it's right here, Nora, if you look on the screen.
Yeah.
So it looks at their savings, their checking, cash on hand. So it's really.
So my question to you is, what is? I know that the budget for the ISP is approved by a different entity than the services plan, right?
Well,
so what I'm asking is, the review also done by someone else, or is it also done by the service coordinator in terms of budget?
The actual budget for the person is done through a calculation based on a functional needs assessment.
Mm-hmm.
That is something that goes in Oregon through the state.
Right, they have to approve it, right?
Yeah, many states have similar processes where there is some kind of functional needs assessment which determines the rate, and that's separate from, the service coordinator is a part of the team that does the functional needs assessment, but is not the person who says yay or nay in terms of the rate. That's a higher level responsibility.
I think they may ultimately submit it to, thinking in terms of our prototype, just a general workflow, the case manager, service coordinator may, once the functional needs assessment is complete, the rates are set, they, and that is tied to the ISP, they submit the ISP along with the budget for the ISP to the state for approval, right?
There you go.
Okay. And then the state approves, and if or not, and then if not, they negotiate, and see what needs to be changed. Yes. So the thing that we'll not have in our prototype is the rate setting based on the functional needs assessment.
So
at least right now.
Just one quick question: is this functional assessment administered every year?
Actually, in Oregon, it is going to be administered annually. In other states, it happens like every 3 years, every 5 years, or it can happen. Let's say I'm cruising along, I'm doing fine. I live in Wyoming, and my functional needs assessment only gets done every 5 years in Wyoming. Okay, but then I come down with multiple sclerosis, and I'm not doing well at all. So then the team would pull together and have another functional needs assessment because my health situation has dramatically changed.
Right. And what we have is just the outline of the CIS right now.
Right.
But yeah, that's one area that we definitely can expand upon if we have time within the prototyping phase. But otherwise we need to be able to have a story to talk it through when we're doing demos.
No, I agree. I just wanted to make sure that we know that there's a difference between approving the services plan and the budget, and how that the services plan is reviewed every year, but not necessarily the budget in all states. That's just something to be aware of, I think.
Yep. You're drawing out a very important point, Nora. Yes.
So the services plan is reviewed annually, but not necessarily the budget. Okay. We're going to have talking points at some point, just to really dig in for everyone to learn this, all the intricacies of this. So it would be very, I think the first piece of this, what I'm seeing is that these forms need to be created, and we can talk through that these could be in an offline mode, tablet only, or available on a tablet.
Corey, one last question for Jean. Sorry.
Sorry,
Jean. Jean, so this financial review, do we do that just to monitor how much is being spent, or does this go back to Medicaid eligibility?
This is strictly what I've got in my checkbook that I may have through a Social Security payment or the job that I have, things like that.
It has nothing to do with your Medicaid eligibility.
No.
But you do redetermine that every year as well. Well, at least your service coordinator monitors to make sure that your income stays below a certain level, so you remain eligible.
Yes, that is true. That is the accurate statement. And your eligibility for waiver services is renewed annually. That's what we call level of care, right?
Right. So the waiver is separate. So these are two separate things. If you're on a waiver, then you are going to, the level of care is all rolled up into technical and financial, and you have to redetermine that every year for waiver eligibility.
Yes.
But for example, if you're on a state plan, the rules are a little different.
Although it certainly is kept an eye on, yeah. But the rules are different, and it's kept an eye on.
Okay. Sorry, I just want to make sure that I'm...
No, that's important. I'm kind of... Yeah, I'm kind of seeing these forms. I mean, they are, even though they're kind of labeled the same as maybe our eligibility or intake documents, and also what needs to be reviewed on an annual basis, they are separate. Jean, the overall purpose of this, I mean, the service coordinator, the case manager, they just have a responsibility to monitor this on an annual basis.
Which has to be done twice a year.
Twice a year. Okay, it has to be done twice a year. And that varies by state?
All of this stuff varies by state.
Okay. So are the checklists, the monitoring checklists, are they the individual things they may ask in each state may vary, but are they pretty common across most states?
Yeah, I mean, more sophisticated states, yeah.
Okay. Well, that's what we want to go for.
People, you're in Mississippi.
Yeah, they may not do it there, but who knows? I mean, they are looking at revamping their system, so.
So Jean, these monitoring forms, you guys do this, and in addition to waiver clients to the level of care review yearly, you could do both.
Yeah, you do both.
And you do this quarterly, right?
No, you have to quote monitor the site unquote quarterly, but these forms, all of these forms except for financial only get completed once a year. Financial gets completed twice a year.
Okay.
But of course, if we have a system that allows them to put it online, they're going to be like, yeah, why not give us the quarterly data too?
Yeah, I mean, a county like Lane that has done so poorly in monitoring for so many years, to put it online and have them dash it out quarterly would be pretty awesome.
Well, and the thing is, what we can do, I mean, if we tie dates to these reviews, basically they can run and slice and dice it however they want to, right? They can run it for a specific quarter or a month or whatever the case is, or for a specific service coordinator, client, or individual.
I just think we need to realize this is a separate thing than the level of care review, and we need to, even if we don't mock it up, we need to realize that we haven't done that.
Yeah. Yep. Let me just understand the following. So as we'll get back to building these checklists, because we're going to have to do list screens with each one of these, I think, so they can add additional ones and then record, all the previous data as well. But let me just ask Jean the follow-up statement. So can you just explain what that is? I kind of know, but I want to make sure we're all on the same page.
Well, on the forms, there's an area that is follow-up needed, and basically the services coordinator writes in comment, follow-up necessary, and can you hang on 1 second? Sorry.
Yeah.
Hello?
Is everyone still there?
Yep.
Yeah, I'm here.
Tony, are you still on?
I'm still here.
Okay. So I'm thinking, we can use these forms, basically same information. What we have to do is, and that would be under, it probably is a whole separate tab, so the monitoring forms.
Yeah.
And then each one would be, behavior, or it would be medical, behavioral, financial.
And level of care. We should have a tab for level of care.
We have 3 tabs now, and this would be like a 4th tab.
Yeah, well, we have 4 tabs right now.
Okay.
Yeah.
Well, what do you mean by level of care? I mean,
Corey, the distinction I'm trying to make here is these forms are not, if you're on a waiver, these aren't what they use to redetermine your waiver eligibility.
Exactly. No, they are totally separate.
Yeah. So, but we do need to indicate that we know that the waiver is also redetermined on a yearly basis.
Well, yeah, but that would be under, they'd have to go back to their intake. I mean, in our simple prototype.
No, in our prototype, we don't even cover redetermination.
We don't, but I don't really want to confuse that with the monitoring forms because it is separate. I mean, I think if we're going to do that, the redetermination, I think we put it under maybe our intake area or some other place.
We can have a pretend tab there, just a placeholder redetermination, but we shouldn't skip over it entirely. That's all.
Maybe we need to break it out more by role, because the case manager is doing the monitoring for the service coordinator, and the navigator is doing the intake and the redetermination, probably.
Yeah.
I don't know who does the redetermination. That's a good question.
Probably the
eligibility worker does the redetermination.
There's the answer. I was thinking that, but I couldn't come up with the words faster than Jean. So yeah, you're right.
The annual level of care is done by the services coordinator, but the determination and redetermination get done by an eligibility worker, a trained eligibility worker.
So the annual level of care is done by the SC.
Yeah.
But the actual determination.
Well, determination of eligibility happens at intake. Okay.
Right.
So when Tony first shows up at the door, his eligibility gets determined.
Right.
And if Tony is, say, 2 years old, then his determination, he gets a redetermination at 7 and then again at either 18 or 22, depending on if it's determined that he has intellectual disability or more a global developmental delay.
Okay.
Right. No, I understand that, but the redetermination, is it, so you guys, the eligibility navigator is the one that makes the decision again?
Yeah.
Okay, so the service coordinator is going to do the LOC, and then they are going to send that to the eligibility navigator to make the decision.
No. The LOC is its own thing. It happens annually. It's got nothing to do with eligibility determination. Eligibility is
That's what I thought.
is more, that's when you're looking at the person's like medical records and determining if they in fact have developmental disabilities.
Right. So
is about, does this person still have significant functional delays, and are they continuing to, would they continue to need institutional services if not for the community services that
they were receiving? And so that would fall within monitoring then?
No, level of care is something that's typically done simultaneous to the service planning process, the annual service planning process. So I do the service plan with Tony, and then I also, the annual service plan, make sure that Tony is still eligible for the waiver.
Okay, so in our thing, it would probably go under ISP.
Right, but
it should be part of the ISP process.
But we have the LOC assessment initially, the initial assessment here under intake, right? And is it the same information that's captured, annually? So basically, okay, so maybe what we do, maybe it can stay under intake, the initial one, but then under ISP,
we call it redetermination.
No,
it's not redetermination though. It's level of care review or something like that.
Annual review. Okay.
Yeah.
Jean, if you are on a waiver though, you do have to retake the functional assessment every year, right?
It depends on the state.
Oh my goodness.
Let's not go there yet.
Okay.
States, like when you go out to the cowboy country, South Dakota. Actually, no, South Dakota, the functional needs assessment is done annually. I think North Dakota, it's done every couple of years. I mean, it really depends on the state. Probably the most distant probably 5 years, but definitely, I mean, to do a functional needs assessment, it's a huge task. It takes like half a day to a day.
Right.
So some states just don't, they don't have the resources nor the need. I mean, think about yourself. How much do you change in terms of your adaptive skills from year to year?
Not much, but I know in Virginia, for example, like my cousin is autistic, and he is 3, and I do know that they administer one for him every year, but it's possibly because he's a child, so it's a different.
Yeah, or they have just decided that that's what their state policy is. It really depends on the state.
Okay. Well, let's get back to the monitoring forms. I mean, it's all really good information. I think we have to follow up on the redetermination, level of care, review, or annual LOC, because we don't have that concept of that review in here. A lot of this information we have under intake is just a straight, this is done once. We don't have, the review or the annual options here. But I do have a question. Okay, so we were on the follow-up piece. So that would, okay, that makes sense now. So if there are follow-up items, we may need we'll have to come up with an example of one just to plug in somewhere. But that would basically, so from here on the monitoring form, that would basically go directly here on this column for the follow-up statement, and then the timeline. And then, I don't know if we have responsible party in here or not, but we can put that in. Okay. Now, Jean, so the service coordinator starts this, right? As they go out to Shangri-La, the residential site, they go through their, they probably review their caseload of those individuals that live at Shangri-La or that, in residential or adult, day services. So they, in our concept of the prototype of a system, they would either have a laptop with them or a handheld. They would pull up the monitoring forms in the system and complete it for each person. You said that there's 3 copies. One goes to the case. So when it's completed, one goes to the case file that would be at the case manager or service coordinator level, right? Mm-hmm. One is given to the provider, and then one goes to the office assistant. Who's the office assistant work for, the provider or the service coordinator? I'm sorry?
The county.
The county, okay. And that's where the service coordinator works, right?
Exactly, yes. Okay. And again, that spreadsheet is reviewed by the supervisor in the aggregate and also individually. So I can, as a supervisor, I can look at how Julie Hoyt is doing in terms of fulfilling her responsibilities. I can look at how Shangri-La is doing in terms of fulfilling their responsibilities, and so on.
Is it reviewed? Remind me again. You may have said this already. Is it reviewed at the state level by the DDA? I'm sorry.
It not at this time, although, with the caveat that because, again, Lane County, which is, kind of where we're living here, is doing so poorly in monitoring, it probably will be reviewed by the state.
Are there statistics that would be possibly reported to the state, like for a specific case manager? Let's just say it's the county, for a specific county or case management agency, whichever is,
For the county, yeah.
In Oregon, it's the county, right? In some states, it could just be a designated agency.
Yes, exactly. But it wouldn't probably be a particular service coordinator's data that's being sent to the state. It would be the county's data in toto.
So maybe on a dashboard for the state, that's a good concept of, looking at the county and the percent of monitoring checklists that are completed versus not. So just keeping that in mind, maybe for an example on a dashboard for the future.
Yep.
Okay. I'm not sure who. Somebody might have their microphone a little bit too close to their nose because I'm getting a little feedback on someone breathing into the microphone. Maybe it's me. I don't know. Sometimes I do that too. So what's the P note, Jean?
Progress note.
Okay. So
every time Julie Hoyt goes out to monitor a site, she needs to come back to the office and write a progress note.
Okay. In that individual's record.
Yes.
Does that mean that the monitoring activity is a billable activity?
Yes.
Okay. So what we would do then, I guess, is we have the concept of, pull that up here. Maybe that's a specific service that they would record. And I think what we could do is if we have the monitoring forms as a separate tab, once they complete the monitoring form, they can also have an option of creating a progress note directly from that monitoring form. And that would take them directly here so that they could complete it, just to save a little time. Okay. And we probably want to, well, I mean, we don't have to show it necessarily, but we could just talk that through, that it would pre-populate what was done with the service and the title, or the service date, etc. Okay.
So I hope you all heard when we did the demo in Lane a couple of weeks ago that the managers there, and I would say that this is going to be true of this state, they want to see a continuous scroll of the progress notes. They don't want to have to, go back and forth.
I do recall that. It's good to bring it back up, though. So you mean a continuous scroll within an individual's file or across individuals?
In the individual's file. One individual's file.
So you mean date by date, like if you could just navigate on that list, or?
I do recall what we were talking about. Not necessarily on the list, but more in. And tell me if I'm wrong, Jean, but in like basically more information either on the list, like what the progress note was about. But I think we talked about, well, we could do that in a report. I mean, on this page, we could just have, view report or view something where it would give all that information in one long document. Is that ring a bell, or does that make sense?
Okay. What they want is the progress note reads like a book, the progress notes.
Right.
Okay.
So it's one continuous stream of progress notes. There's no problem to navigate back and forth. There's no printing a report. There's just, I open up the case notes section and I see one progress note after another. And that when I go to enter, I just am entering the next progress note, and I am actually looking at all of the previous ones.
Okay.
Corey, would you open up that one? So if you had a next button or in a previous button, is that the idea? If you're in a view mode, if you're viewing a note on the screen and then you click next to see the next one, the next sequential note.
It's not about next. It's not about a button. It's about one paragraph, second paragraph, third paragraph, fourth paragraph. And each of the paragraphs has, I'm looking at yesterday's progress notes. I can see it as I'm writing today's progress note.
Okay.
I got it.
There's text. You see, you're viewing information while you're typing information. Then.
Yes.
Okay.
Is it like copy paste at all? I mean, no. if you just write it, you have the same method of doing it over and over again?
No, it's not that. It's that
I
don't want to have to switch back and forth between screens to see yesterday's progress note versus today's progress note versus last week's progress note.
Okay. So they want to be able to, there could be a concept we can come up with, because that's not how we have it framed right now, but that's okay. I mean, that's what was frustrating them when we did the demo. Okay. Sure. So we'll regroup and try and figure something out there. I don't know how to do that.
I think we can figure it out.
We can figure it out, though.
Yeah. So I just want to make sure. So, like in this one that we're taking a look, that the staff member Corey Schnorr made 2 progress notes on, presumably, let's just say this, would it be the same individual? And then you just wanted to see the last progress note that Corey Schnorr wrote on.
Not
just the last, but all of them.
Yeah, so we have to, and it is for one individual. I mean, it's not across, it's for one individual. So we have to have some sort of concept of, on screen, being able to, I'm almost thinking like a scroll window of all the previous progress notes, kind of as a view, right? Where they can scroll up and see all the previous with maybe the date, and we don't have all this information there. We just in this. I'll have to kind of frame it out, but we have the date.
Are those even the right fields that we should have on there? Like, should we have different fields that are showing up in that table that you're scrolling up and down on?
I think the add new should stay the same, where you add in all that information, and the description, there should just be a timestamp and the description. If the person wants to see more, they can hit view, but all you're going to see is the timestamp and the description of each case note. If they want to see more than that, they're going to, like who wrote it or specific information, they can open up the file. But essentially it'll look like a running paragraph with views next to it, blue links.
Yeah, I think so. I think that's...
So it's fine, it's fine to have this box that we're seeing on the screen right now, but once you submit that gets added to the running scroll of progress notes.
Mm-hmm.
Oh, so the progress note is one big blob of progress. It's not separate entries.
For ultimately, there are separate entries, but I'm sorry, I'm not explaining this well. So this is fine the way you have this set up on the Create New. Okay, so I would write, data assessment plan. I would submit.
Mm-hmm.
Then I would be able to. Once I submitted, it would just be a part of a running series of progress notes that I would be able to read.
Yeah, I think it's exactly what Nora was saying, is that what we could do, it's still, I think, Tony, it's still what we can classify as a table, but it doesn't look like this. What it looks like is it's probably taking up a lot more of the screen, and it's just more of a scroll. You basically it looks like one long sheet that you can scroll down through. What I'm thinking, and Gene, tell me if this is wrong, but what we would have is basically just the date and the entry, the progress note entry next to it, and that would be one paragraph. The next entry would be another date and paragraph, right?
You want to be able to see the service date, the date it was submitted, the note itself, and also what the service was. So was it monitoring? Was it eligibility determination? Was it annual plan development? Things like that.
Okay. So I think we can do that where it's maybe I'm thinking in this area we have on the left maybe the record, the data with the record, like the date, the service, maybe just underneath it, like we'll figure it out. We'll demo it up. I don't want to explain it on the phone, but
we have two separate screens.
At least one field that needs to be added, and that's the progress note that you have to be able to see without opening up another window.
Yeah, but I think all of these other fields, Tony, could be.
I don't think it's going to be a table.
Okay. Or something. We don't have to use a table, but somehow the key piece of information that we're not seeing here is the progress note of that information that's in the system.
Okay.
So
I think I'm wondering if we still want to have a search function in addition to the add new, because I could envision somebody wanting to find a note on a specific date, and then when you add a new note, it brings up that window that you were showing a minute ago, Corey. And it seems like at the bottom of that window, that screen, would be where you have that scrolling history of all the notes, not on this page.
Okay, so that add new window, there's another component on that allows you to scroll up and down.
That's how I would envision it. It just, you have two different options of reviewing your notes.
Let's work it out offline, guys.
Yeah, who wants to take ownership over that, over redesigning? I'm gonna either ask Tim or Noor to look at that, or I can do it.
I can.
I don't know. I haven't gotten through appeals yet, so once I'm done with that and the MMIS, I can go through this. So
Tim,
whoever gets to it first.
Tim, why don't you go ahead and take a look at it if you have time?
And then I can jam with you on that, Tim. Whatever. I don't have a good vision on what we want it to look like, but I can help it. Seems
maybe
like we're going to come up with a different visual concept.
Tim, is that cool?
Oh yeah, that's great.
Okay. All right. No, thanks for reminding us about that, Gene. I'm sorry. There's just been a lot of other stuff going on. So.
No. It's a really critical thing for these guys.
Okay. All right. Good to know. We'll definitely make the change.
And it would be the same for any state. So.
Okay. I will take a stat. Well, maybe Noor, you and I, after you're done with the appeal stuff, we can work on the monitoring forms. But I can take a stab at kind of laying out everything, how I'm envisioning it.
Right. Yeah, we can discuss that, Corey,
Okay.
you and I, and see if we can come up with an idea. Gene, maybe I'm being dumb here, but I just don't get the financial part of it. What's the purpose? Why are you doing that?
The financial monitoring form?
Yeah. Why? If you're not using it for Medicaid eligibility, what are you using it for?
You're basically checking up on the provider because the provider has access to the person's personal spending.
Right.
Generated by Social Security or their job or whatever. And basically, some providers run off with people's money.
Ah.
Their personal money.
So this is a compliance thing. Okay.
This is all compliance.
Yeah.
It's kind of like an audit almost, that they're making sure things are all in line.
Okay.
And also, I've known providers to use people's money to pay for things that don't benefit the person but benefit the provider. So, you're talking about staff that are making minimum wage, right? And they're looking at a consumer's bank statement, and that person may have like a couple of $1,000 in the bank at any given time because of their Social Security.
Mm-hmm.
It becomes tempting.
Okay.
Take the money. So basically everything has to have a receipt attached to it, and the services coordinator comes in and checks the receipts versus, like the bank statement.
Okay. All right. Sorry about that. I'm just being a bit slow maybe this morning. I just wanted to make sure I understood it.
You're fine. You're fine.
We like to think that everybody's got everybody's best interest at heart, but the reality is that, unfortunately, there's a fair amount of thievery that goes on. So.
Okay.
Yeah, I'm sure there is. Okay. So, well, Nora and I will take a stab at the monitoring forms. That really, really helps, Jean, frame that.
Yeah.
We just didn't understand it before. Just looking at it.
No, it's it's sad to have to be able, but I mean, it's just how it is. So.
Mm-hmm. Absolutely.
Yeah.
I want to do, in the last few minutes that we have, we can go over too if you guys are okay with that, but I want to go through and see where we are with everything. So, okay. Actually, instead of me going through this, why don't you guys tell me where you are with everything? So, Tony, do you want to start?
Yes. So if we go over to the dashboard alerts, we've got, right now I've got the Navigator dashboard and the Case Manager dashboard have a very similar design.
Okay.
Basically, I just took the icon, so there's a style in there. It's the same type of thing there. But I don't know what that tile was, but that was in the old one, so that's there.
Okay.
So we basically have the different portlets. These are in masters. We can update.
Okay.
The case list status. We can. We have the ability to, right now, we can just hand type in that information, or if we have it in a sheet, we can have it filled out there. The component that we need, I just need to finish off today is the behavior where if you click on a client under that client list ID, it shows you what that client list cloud looks like on the left. The tab, if you go to the administrator dashboard.
Yeah, actually, let's go. Hold on.
Sure.
So all we need, Tony, is basically, I think, instead of clicking on a specific client, so this can just be, we could have Scott Strawman in here. We could have a few other fake clients just pre-filled in there. We don't need to worry about a table behind it, or however you want to do it. Just something that's easy. I was thinking almost just an image is totally fine, just to get it in there.
Okay.
Because we can walk through that. So what we need up here, probably where this little icon is, I don't know if you can see
that makes the most sense. Yep, I like that. I mean, that seems like otherwise they don't do anything; they just sit there. So
we don't need to, because we're going with the concept that it's a prototype, it's a concept, it's not it doesn't have to all be working. So, and that's okay.
But the thing that you do to make it switch to that client list page is those two rectangles.
Clicking, I don't know if I like the rectangle. I guess that's fine.
I mean, I just copied that from the old prototype. It's
I don't know if that's easily recognizable as an action item.
I don't think so. There's Font Awesome uses a different one where they where it shows like a rectangle with an arrow pointing out of it, indicating that it's going to get bigger.
Guys, I'll be right back. Sorry.
Okay, that's okay.
Yeah, there are other icons like that because basically you're maximizing it.
Yeah.
I don't think that means max to me.
Let's keep it simple. We could also just make this an action button. Okay. Underline it, make it blue.
Okay.
Or put, view, something like view over here. I don't, whatever you want to do, just don't spend much time on it because it's not that important. We need to have an action button, but so if you do that, then definitely it goes to the client list.
Okay.
And again, this doesn't all have to be searchable or active.
We'll have a field with those things in there.
Yeah, basically we have to have our Scott Strawman here and be able to click on his record to take us to his either profile or his whatever you want to call it, his
there's the case there's this case manager paradigm where it like brings them to the navigator?
It depends what view we're in. I mean, if we're the case manager, then it's going to take us to a different view for the menu, right, than if we're the provider. Gene, just to back up a little bit, what we are doing, so we've got be able to navigate easily through a prototype and a demo. We have to show different views. So the DD administrator view, so the state view, right? And so we stole some of this stuff from LTSS, from aging, etc., which is fine.
We stole everything except the top banner.
Yeah, and so some of this stuff.
Until disabilities prototype, that was ours.
That's ours.
Nice.
I know exactly. So we'll have to tailor these boxes more to our population, more to the DD population. These are, this is from Maryland Department of Aging, so we'll change that to be more generic and more specific to DD.
Okay.
Yeah.
So we're not there yet. We just had to get this programmed in. So basically, within the DD administrator dashboard, there's not a whole lot. We won't show like we do, the specific client menu on the left, because they don't need to see that. They need to see more aggregate data. They'll have alerts if they have to approve a specific client's ISP, et cetera, et cetera. So we have to figure that stuff out yet. The navigator dashboard, that if they do, of course, click on a client, and we'll need to change. Gene, we're having trouble. I mean, we want to call it like the individual list, but that gets kind of confusing. Is it okay to use the term client at some points? I don't know what other term to use.
Well, people are called consumers too.
Yeah.
So, consumer list?
Yeah, I mean, you could call it consumer list or client list.
Is consumer more acceptable in the DD world than client?
Yeah.
Okay. I just made a consumer list.
Okay. Okay, so then if, they'll have access to, Tony, how do I get back to just our regular prototype from here? Instead of having to...
We need to put that up like a master thing. It'll switch us back.
Yes, just to put a back button in there, some kind of button, Tony, where it just links back to that prototype.
Okay.
Yeah, and if we have the links in, if we have the, linking to the client, we'll figure it out.
It's an easy thing. It's just a button.
Okay.
Tony, I can put it on there.
Okay.
It's pretty ezy. So Tony can put it on there. I can put it on there. It's not a big deal.
Okay. So then from the client list, once we select our Scott Strawman client, and that's the only client that we have to worry about showing this, is we can pull up there. This is from the navigator view, so we would have everything. I'm thinking like ISP, that would not exist at the navigators. That would be in the case manager view, right? Enrollment would all be at the navigator view. Intake would be at the navigator view. Case note would not be. So we'll need to remove these two items from the navigator view. Because navigators, Gene, won't ever do case notes, right? They'll never do progress notes, nothing like that.
Well, you mean by navigator
the county person? Oh, I'm sorry. Yeah, the enrollment navigator.
The eligibility determination person?
Yeah.
Yeah, no, they're not gonna do,
I was just going to see my map.
No, they're gonna do case notes. Is that what you're asking? What are you asking? Sorry.
Yep. What I'm asking is at the eligibility navigator or enrollment navigator, will they ever need to do a case note or progress? They will. Okay, so let's go back here. And then we've got our case manager dashboard. We haven't gotten to the provider dashboard yet, Gene, but it's going to look very similar. And so then, same concept here. They would have access to the ISP. They'd have access to the case note, the monitoring forums.
And Corey, on this one, right now, as far as prototype go, it'd be a copy paste of it.
Maybe the same as this, yeah.
Since it looked like the exact same design, since I didn't have different information, I didn't want to confuse ourselves.
That's fine. You can make it the same. You can make it look the same.
Okay. The only difference will be the title will say Case Manager Dashboard as opposed to Navigator Dashboard with those 4 boxes, and I don't know that icon.
Yeah, I mean, it will probably end up looking a little bit different, but for now, you can just make them look the same. Okay. So Tony, that took us way far off. Sorry, I just wanted to clarify that.
I'm sorry. What was way far off?
Oh, just that review, that explanation for Gene, and for all of us of the different views. So you are working on this, Tony.
Yeah. So in terms of the item there, it's really just that. Some behavior, I'll just have it if you click on consumer list, it moves you to that screen, and we can come up with something else. And again, we're kind of stealing from LTSS, so I'm not sure what they intended those rectangle boxes to mean.
What rectangle boxes? Hang on.
Which ones?
Ones on the right-hand side.
Over here.
Maybe that means that it would maximize, so the thing in the rectangle.
Yeah, it would maximize. That's what it means. It's maximizing, but that's not from LTSS. That's just from another prototype.
Okay, so then that rectangle box, if you hit that, then the alert becomes small, and then the consumer list becomes in the big area. But you always have those things on the right-hand side.
We don't even have to model that behavior, Corey, unless you'd really like to.
No.
I just want to know what it should look like when you click something.
Don't click. It's not clickable.
Yeah, I would remove these.
Some way to get to that client list.
Yeah, Tony, I would remove the boxes because I don't think that makes sense to me and to most people. At least we're not going to minimize these at all. We're just going to leave them static. Consumer list, and like I said, either make this an active link to take us to the consumer list, or have a link, something that will take us to the consumer list. The caseload status, I mean, worry about the consumer list right now.
Mm-hmm.
That's our focus. Caseload status.
And that's really, I'm just designing the next screen that it goes to. And then there's something that you click on there, it takes you there. So I'll just make it, if you click that bar, anywhere in that bar, it'll take you over there.
Exactly. So that'll take us to our client or consumer list. And this will be your next. Are you going to work on this one too, Tony?
Yep, that's what I'm working on right now.
Okay.
Corey, why are we cutting jurisdiction? Why don't we leave that as is?
Why did I want to cut that? I don't know if I have a great reason for it. I guess I was thinking it didn't necessarily apply, but maybe it does.
Well, it's the county that the person is associated with, or the area off as the catchment area.
Yeah.
Okay.
Editable only from the first.
Sorry, good catch. Leave that then, Tony. Okay. Jurisdiction. Sorry, guys.
And that will fill up the entire tabbed area. There's within that little design thing that we have.
That's fine. And then as soon as they select, I would assume under actions, to search the profile or maybe the case, to select Scott Strauman's case, then it would take them to our menu on the left, right? But they don't need to see that menu until they select the profile.
Yeah.
Or the case, I guess.
Yeah, because this is a wide screen, so it would be nice not to have that left menu on the left-hand side.
Right. Okay.
And this is where we're going to search and pull up Scott Strauman, right?
Mm-hmm.
Okay. So, Tony, I think for this page, all you have to do is have some... I don't think we're actually going to do the search function, right, Corey? It's just going to be that Scott Strauman is already populated in the bottom of this table, and you're going to hit View, and that's going to link to him.
Yeah, I think that's fine. I mean, we can have a...
That's what I'm thinking. Like, this search thing, it doesn't even fit into the story, because if you hit Scott Strauman on that list, it seems like that just takes you right over to...
Well, why don't you do this? Why don't you just put in Scott Strauman's information down here,
mm-hmm.
and then also in the last name just put Just put Strawman Scott under the search.
It seems like before this client search screen shows up, there ought to be a button called client search that you click before the screen shows up. Otherwise, it seems kind of a weird story. Like in terms.
Well, no, but you get that from the dashboard.
Yeah, you're just getting it from the consumer.
So the dashboard should have a button under client list. It should have something like search for client. So you can either click Scott Strawman and it takes you right there, like you searched and pulled them up. Or that's
what I was thinking we would have right here. So basically, whatever link we put on this consumer list.
Corey, could I just put one more tab to the right of the case manager dashboard and just say client search? And then you get the Scott Strawman one of two ways. You go to client search, and then that Scott Strawman will take you there, or you hit them from the consumer list. Because
where are you putting another tab?
Just to the right of the case manager dashboard, client search.
I don't think we need that. I think just for our demo purposes, our prototype, just a link right here in this consumer list, because don't you think? I mean, I don't know that we need another view, because these are our major views.
Well, I guess my thought is the consumer list, that's already a selection of clients that you're working with. So I'm guessing that one you've already put in your criterion. That's you're just clicking the client and you're going to go do something with them, because that's why they're on the list. And then searching, that's like, obviously you don't have them in front of you. I guess that was just...
Maybe it should be a higher level on the left-hand menu.
Yeah, some sort of concept of...
So why don't we make a client search tab? That's not a big deal, Corey.
Okay. I'm just trying to... whatever
Actually,
you guys
I don't think that's a lot of work for Tony. I think because
it just makes more... I mean, if you have a search screen show up...
What I was trying to do at the top with the tabs is make it and have our story that when you log in as an administrator, log in as a navigator, log in as a case manager, this is your landing page, basically, your dashboard, at least in the prototype. Yeah. Whatever you guys want to do is fine.
I agree, Corey. I don't think you should have
within that little consumer list portlet, maybe a button that says search.
That's totally fine. Yeah, exactly.
Yep.
We just need a way to get from this screen to this screen. However you guys want to do that is fine.
Okay.
I don't care. Don't care.
And Tony, I know that Corey had said change it to Medicaid number. I think we can leave it as MR number and just copy paste this whole part, this part as a screenshot. I don't think you should really do much work on the top part.
Okay.
Just, put in fields on the bottom. I'll show it to you if you.
That's totally fine, Nor. Just remove, Tony. Make sure you remove the home clients, my lists, alerts, dashboard reports up here at the top.
Yeah.
Okay.
Just that way it's less work.
Okay. So Tony, focus on that stuff, and then I mean, let's try to wrap that stuff up today.
Case
the thing that I want to
clear that thing goes too, right?
I'm sorry.
Search case profile and clear. Those buttons.
You can leave that in there.
Searching.
Just leave it.
Leave it, because it's gonna be a screenshot, Tony. You're gonna screenshot. You're just gonna cut out the top tabs. You're gonna screenshot the center part here. It's not gonna be active.
Okay.
Perfectly fine. But then we just need a way to get to Scott Strawman's profile and his case, right? So if we are on, going back, the next thing, who was working on the profile? Because we were revamping that.
So that profile is in the other prototype. I could bring it in. That's at Lightbox. So that's in the other prototype, and I could bring that over to this one.
Oh no, we were gonna not do that. We were gonna take it from. We're gonna take it from the prototype, Tony.
That's not it. We were gonna steal it from. I thought was it the Maryland Department of Aging?
Yeah. We were gonna just take this one directly. I don't know where MDOA went here. It was here. Oh, it's on the bottom, right there, and then.
Client profile. Yeah. So the expansion. So just steal it. Steal exactly how this is.
Okay, so when you hit that, then is that in a tabbed thing too?
Well, let's look at our. 1 second. So right now we have the edit profile up here.
Yeah, and we didn't really have a good story for it, so we just had like a splash screen, just kind of it's like a modal window.
Um,
And that's on the that was on the other prototype thing.
Yeah.
Let me just send you the link.
Can we do a splash screen with this client profile concept? Like this pops up, you can
Yeah.
click to expand or collapse on the splash screen.
I think that's a good way to do it. I mean, especially if we do anything where it doesn't quite make sense, that splash screen is the best way to do it because then it just kind of disappears. So we'll just kind of keep that rectangle there, and then you could it's shaded in the background, and then you can just make it go away.
Yeah, there may be like fiscal eligibility. Some of the stuff we may have to remove, but for now you can put it in if it's
okay.
Okay, so that is another one of your tests. So Nor, what do you have going on?
I was out yesterday, so my job is to do the appeals and to recreate that MMIS screen that we were talking about last Friday.
Do you want to look over the the incident reporting really quick?
We can look through it, yeah.
Where is that?
It is reportable events. Okay, go to new reportable event. Right. Select that. Select all 3 program types.
Okay. And
Hit save. Yeah. Okay, open up summary.
Perfect.
And then you can open up all the tabs. And
So
Tony made them scrollable, so they shouldn't be an issue.
Cool.
Yeah.
So that
Gene?
seems like that needs to fit within something, right? So is that going to be?
Yeah, I think that's its own. I don't know if it's its own menu item or not.
Incident reporting? Yeah, it should probably be its own item.
Gene, what are your thoughts on this? Does this make sense to you as far as incident reporting?
I'm just thinking we're going to probably add the menu to the left and the headers to the top on that.
A complaint is different than an incident.
I'm sorry, what's that?
A complaint is different than an incident.
Okay.
Right, there's alleged incidents and then there's complaints. And there's two. In LTSS, they put them both in the same form, but you can indicate whether it's an incident or a complaint.
Where do they indicate that?
So go open these other tabs. This is event information. Okay, this is the event type, incident. You can, if you open that, you can decide what type it is.
So that's how LTSS does it right now?
Yeah, and then you can, here in the bottom tabs, you can talk about the alleged incidents or the complaints, whichever you like.
Do any of the subsequent fields change if it's a complaint versus an incident?
No, you just fill out the appropriate tabs based on whether it is a complaint or an incident or both, because it can be both.
I think for DD this is a problem.
Okay.
Because in DD a complaint is when I don't like my services for me.
Okay.
I want it changed. I want that person changed. Or I didn't like how I was treated by office. Things like that. Whereas an incident is somebody stole my money.
Yeah.
Well, it seems like it would be pretty easy to take out that complaint tab and just have a separate form.
Even though you're collecting similar information, they're very different things, and I think putting them together is going to be confusing for folks.
Okay. What is the incident reporting more important? I mean, in our prioritization, are we looking at doing that first, or yeah? Okay, so
we can sit down together tomorrow and go to the school.
I hear Marion in the background too.
Sure, thank you.
Tell them to be quiet. Can you shush her? You're fine, Tim. Sorry. Okay. Well, let's. Yeah, I that's fine. That's fine. I'm not worried about taking complaints out for now, and making it just specifically incident reporting. The other thought I had was that if we wanted to use the same section and make it reportable, I don't know if it's both called reportable events / complaints, but then on the first summary information, basically select whether it's a complaint versus an incident, and then things would change below that. But I think that's going to be more confusing or complex for us to prototype than just removing complaints and putting that in as a separate one.
Right. For an IT system, Gene, the reason that they put it together is because they're gathering, I think, the same information, and for reporting, you can distinguish very easily which is which.
Yeah, I understand the logic of putting them together. I think visually, though, for the end user, it's problematic.
Okay.
Okay. Yeah. Okay. Well, I mean, definitely, we can. This is.
Yeah, they're seen
prototype.
as
We can do whatever.
Things.
Yeah, we can do whatever we want to.
Apply. There's no load-bearing walls on this.
Exactly. That's nice. We'll let the developers worry about that in the future. Right? Okay, so beyond that, Nora, I like this. I think this just makes sense.
So, Nora, just the only thing we need to do to take this to finish is, I just want to make sure, is this thing going to show up within the tab thing, or does this thing show up where we have like the header bar, the client selected bar, and then the menu on the left-hand side? It looks like, is it like this?
It's client specific, right? It's
client specific.
So it would show up on the menu.
Okay, hold on one second. I don't mean to hold on, but I know I need to add to it then, so it looks like everything else.
My thought is maybe what we do is we have a blue menu item that is called something, events, client event. I don't know what to call it. Or consumer events, and then underneath that, the sub-menus, one would be incident reporting, and the other would be complaint. There may be other things that we want to capture there as well.
All right.
But I'm open. Nor, Gene, Tim, what do you guys think about
I think the structure you're talking about works. Okay. What we call it.
Add a blue thing below case note.
Yeah, I don't know what to call it, though.
Well, I just want to put it in there so we can get to it on the next time we...
Reportable event.
Yeah, reportable events.
Yeah.
And would that cover? I mean, if the sub menu items underneath that would be incident report and then
incident report and then complaints.
Okay.
Added reportable events. Reportable. You caught me as I was.
Guys, I need to get some lunch.
And then there's a sub menu.
Yeah. We should probably wrap up anyway. Nora, you need to run, so.
Yeah.
What are the two things underneath reportable events? And I'll let you guys go. Sorry about
that. Incident report.
Mm-hmm.
Incident report.
And complaint.
Corey, it shouldn't be too hard to separate them either.
Okay, perfect. Nora, what do you need anything from us?
No, I'm just gonna start working on getting this appeals done. I can go circle back on reportable events afterwards.
I'll connect with you later on today and tomorrow on monitoring forums.
Okay, yeah.
Tim, if you need help with revamping the case note, just let me know, and I can help you with that.
And I've started work on the claim items.
I saw that, Tim. This looks really good.
Well, it's not polished at all. It's sort of ugly right now, but yeah, I'm not sure if I need any help with that yet.
Okay.
I can also help you with that, Tim. Let me know.
Yeah. I'm happy to. So. Okay. Well, let's see. We as a team we need to meet, in the next couple of days as well. Gene, I don't know if you're interested in meeting with us. Nora, go ahead and go grab something.
Yep. Thanks.
Cool. Can you just show that one form that you're showing us before of Nora, so I can make sure that it's pointing to it?
Oh. was it?
Yeah, that's right. Because I want to be able to find it, because I know I just need to add a couple things to it so it looks like everything else.
And that was the incident reporting. I think it was under...
Reportable events under Sandbox.
Under Sandbox.
Where's Sandbox? Pages organized by menu.
Oh, Lord.
Go down. Go down.
Up from where you are.
Yeah. Pages organized by menu is, yeah, that one. Sandbox. And then reportable events.
Oof, okay.
Sorry about that.
No, that's okay.
So it should link to here, Tony.
Great.
Well.
Okay.
Yeah, for now.
And then I'm going to add the stuff around it so it looks like the rest of the system.
Okay. Thank you.
All right. Thanks, Nora.
Right.
Thanks.
Talk to you soon.
All right. Bye-bye.
Bye. Okay. Oh, I was just saying about meetings. So we'll definitely need to connect over the next 2 to 3 days. I want to get us in a place where we can do a demo for Dr. Gu next Wednesday or Thursday when I'm in town. I think so between now and then we have to make quite a bit of progress. I'd love to have all of those areas complete. And in a good space. That would really bring us into a lot of where we need to be. So if we have my goal is to have phase 2 done by next week, which is a lot to ask. So as much as we can do to get that done would be the best. But I'm sure that Dr. Gu will want a demo at that point. So whatever help you need from me, just let me know. Okay. So maybe what I'll do is I'll schedule a check-in either later today or tomorrow morning for us. And then
I don't know how everyone's schedule is working, but I'm assuming we seem to move pretty, even if we're working in the same room, on separate things to get the jam sessions going again.
Yeah, we can definitely try that. For some people, I think it works better than others. Like I think Nor kind of likes to be able to focus off on her own, and do her stuff and then come back together with the group. Well, we can leave it open.
Block out my time so no one. Well, I do it so no one can schedule meetings during that time anyway. So
let's block out
where I am.
as much time as we can. So do you want to do that, Tony, or do you want me to?
Yeah, I'll go ahead and schedule this.
Okay, and I'm free most of the day tomorrow, so that would be terrific.
Okay.
And then Jean, maybe we can check in. I don't know if you're available later this week.
Only on Friday. I'm
Friday. Okay.
In Eugene on Wednesday and Thursday.
Okay, let's look here. All right, I'm going to schedule something for Friday morning for us all to do another check-in with you and review where we are and get your feedback at that point. Okay.
That sounds.
That work?
It works. Yep.
All right. We're getting there. We're getting there. I know it's been a longer process than what we thought it was going to be, but we were on hold for a little while, so we're getting back in the groove. But well, thanks everyone. I appreciate it. So, Jean, thank you. Have a great day.
See you, everybody.
All right. I'll talk to you all soon.
All right. Take care.
See ya.
Yeah.
Bye.
Bye-bye.